All right, piano lessons are over. I'm back home. Let's try to finish this off. Last thing that I was just about to start, I had said that we'd come back to Clinton, talking about some of the reforms that he had during his administration. And one of the things that he did in 1996 during his administration was get the Personal Responsibility and Opportunity to Work Act passed. And what this did is it replaced the Aid to Families and Dependent Children, what you'll see inside the JANDA, abbreviated as the AFDC. So it abolished the AFDC. It replaces it with the Temporary Assistance to Needy Families program. And so this is a welfare reform initiative that tried to kind of piggyback off of what Lyndon B. Johnson was trying to initiate with his programs that tried to make sure that people were in places that they could work. And there's a graphic inside of the chapter that shows a couple of different demographic groups insofar as percentage living in poverty. And so on the top, the highest percentage that you see in purple, you'll notice that you'll see families with a female householder as the percentage of all poor families. So the single parent households. Then you'll see another line of black households, Hispanic households, all people, an average, and then white non-Hispanic. Just want you to check that out and see um, the the change from 1970 until 2010 and see what the percentages are. Okay, let's talk a little bit about healthcare. And as you may already know, the United States is the only industrialized nation, was the only industrialized nation without universal health care. And in 2010, we had 50 million people, so that's about 16% of our population, that had no health insurance whatsoever. And many of those who did have health insurance were underinsured. We also had public and private spending on health care that had reached an all-time high at $2.6 trillion dollars. And this is almost 20%, at 17.9% of our entire GDP was going towards healthcare. Now, with Medicare, this was an amendment of the Social Security Act that would provide Medicare for citizens who were 65 years of age or older, and it had two components. Part A was for hospitalization, and Part B was for physician fees. If you look under the Unit 5 wiki page, look under primary documents down at the bottom, I've put in links for A, B, and D of Medicare. And so you can see the forms that people would have to fill out to apply for Medicare, and maybe that'll give you an idea of how much of a pain it is to fill all this out. This compulsory program expanded over years to cover other services, and so this would incorporate the Medicare prescription drug, the Improvement and Modernization Act, which was Part D, if you look at that. So go and check that out, and you'll see that Modernization Act implemented. Sorry, my son was just coming in here to tell me good night. I'll go check out how he's doing in just a minute here. Another graph that you'll see in the JANDA that I want you to look at is where you'll see a comparison between percentage of residents below the poverty line, and that's the image that's in green, and then you're going to see in kind of a pinkish purple color percentage of residents without health insurance. And so you'll see Georgia at a little under 20%. We have 18% of our residents being below the poverty line, and we're also at 20% insofar as residents without health insurance. So we're kind of at the bottom end of this. So just take a quick glance at that. All right, as far as Medicaid goes, this is a product of the Great Society, another amendment that was passed with the Social Security Act that I'd mentioned to you earlier. And what this does is it provides aid for Americans with low income. So massive program. It's run and financed jointly between the states. So because of that, eligibility does vary from state to state. Medicaid participants would be children who are under the age of 21. So this is half of the participants in the program actually, as of 2011. You have adults, and as far as adults go, this is mainly pregnant women. This would be parents. This would be other people who might be caregivers for children, people who are disabled, and then those who are age 65 and over. Going back to healthcare reform again, there was the Affordable Care Act and patient protection programs that were initiated. This is this would be considered the most wide-ranging policy change in our generation, at least. And the aim of these initiatives were to provide insurance to as many people as possible. And so, a few things that were specific or notable about the Affordable Care Act is that 19 to 25-year-olds can still stay on their parents' insurance plans. 19 to 25-year-olds cannot be denied coverage due to, or anyone really, not just 19 to 25-year-olds, but people in general, cannot be penalized for pre-existing conditions. They can't be denied coverage for pre-existing conditions. And then finally, all individuals are required to have health insurance by 2014, or they have to pay the penalty and fine for not having insurance under the Affordable Care Act. All right, a little bit about education. So these would be the movements that have gotten us to where we are today. The biggest question that has overridden or has I guess driven a lot of the questions from the federal Department of Education is this thing called equity, and trying to make sure that all people are treated the same. This is the overriding and persistent concern. So there's social equity, there's economic equity, and we see different court cases, different acts popping up because of this issue of equity. Of course, you know Brown versus Board of Education in 1954. So this would be a social, even a racial equity issue. A couple of things you may not be as familiar with would be the Elementary and Secondary Education Act of 1965. Sometimes it's abbreviated as the ESEA. And then, of course, there's the Individuals with Disabilities Education Act, IDEA or IDEA. And with IDEA and with ESEA, these would be other social programs that were initiated to make sure that students were treated or given an opportunity for equal treatment under the law. Something else that came out it was actually 1983, was a report that was called A Nation at Risk. And with A Nation at Risk, this report came out during the Reagan administration saying that our students were underperforming, they were not prepared for the workforce, they weren't prepared for the military, and so this was creating a national security risk. And of course, at the time, we're still kind of on the back end of the Red Scare, and so we're at this constant competition with the Soviet Union. And so if we have an education report coming out saying that public schools are not performing at the level that they need to be, and we've been kidding ourselves for the last 20 years, almost 40 years, people were really starting to freak out about this. And so we have, out of the 80s, a lot of initiatives to try to have a national standard of performance. And so this is what No Child Left Behind comes out of. NCLB 2001. This reauthorizes the Elementary and Secondary Education Act of 1965. And what this does is it becomes a way to try to have a national norm where we can compare students across state lines to see how they're performing. And so it required proficiency in the areas of math and reading by 2014, so that all students would be performing at a level of proficiency where they're all meeting that standard. The negative effect